Yeah, welcome. I'm Dr. Ali Akabi, emergency physician with 5 years experience from Bugando, but also a fellow of critical care from Cardiff University. So I welcome you. What do you have here?
Yeah, Dr. Ali, welcome. We are in an intensive care unit in Shirati Hospital. We have a 40 years old lady who was admitted in a hospital on 20th. She came with she had a normal SVD she had a 5.2 kg baby. And then she was planned for family planning where she was supposed to undergo BTL. But unfortunately, when we were preparing for her, she started to have a tender abdomen with saturating, pulse were going high, the blood pressure dropping. So we suspected that she has an internal hemorrhage, and then we refer her for an investigation, and then we came up with a ruptured uterus. So yesterday she was taken to operation room. So she's 24 hours post subtotal hysterectomy due to a ruptured uterus where she had a normal SVD, but at the end of the day, she had a rupture. So you can see her in the bed. And then the vitals, you can see the monitor because I'm able to see the monitors.
Oh. Maybe focus on, okay. So what I see on the monitor, I'm trying to focus. There's a red alert there. Is it that's the pulse or oxygen saturation?
Yeah, the saturation.
So the patient is having hypoxia right now, or he has cold extremities on the hands. That is peaking not clearly. I can see the wave on the monitor.
Cold. That, I hope that is the cause why we are seeing a low saturation, because also she's having coldness of the extremities, the peripheral.
Okay.
Yeah.
Thank you for the case. To echo you, 40-year-old female admitted 3 days ago and delivered by SVD, a 5.2 kg baby. But yes, then she's planned for BTL. She developed a ruptured uterus, laparotomy done 24 hours ago, and found a ruptured uterus, repaired, and now how is the patient today?
Today she's fine, she's doing fine. She has just ambulated, and then no abdomen is soft, non-tender, no distension. The bowels sound very audible, and then the chest is clear. She's doing fine. She has done a passive ambulation in the morning, and then she has started the shifts.
The blood pressure, may I focus on the blood pressure? Can you focus on the blood pressure?
Blood pressure is 114 over 57.
Yeah. Okay, how is the respiratory rate?
It is.
Maybe the patient is
can do a manual count.
The extremities are warm or cold? The extremities where you have put your pulse oximeter. I can see only oxygen is not enough.
The extremities are warm.
Okay, warm. If the respiratory rate is high, above 22, maybe she is also truly having hypoxia. So we have to supplement her with oxygen. It's good that you did laparotomy and you're able to recognize the shock from blood loss. So now, do the investigations. She may need a septic workup, cover with antibiotics, oxygen, yes, and monitor her vital signs. She may have a pulmonary edema either way or a pneumonia. We may like to know the respiratory findings, or you can also do the chest X-ray. It's good to cover her with an antibiotic. If the blood pressure is allowing, I can see the pulse is 67. I see it clearly, 68, 70. Yeah, maybe if she's anemic, she may need blood, antibiotics, oxygen, and minimal of fluid.
Yeah, the current, she's on ceftaxone and metronidazole IV. That's the antibiotics she's using now.
Then she got the 3 units of blood with the 1 frozen plasma.
Oh, she got blood and FFP.
Yeah.
Yeah.
Okay. Did you do anything? I can see the oxygen saturation is trying to improve, although it's not adequate. It's 90% now.
Now we have put the oxygen. We're returning her back to the oxygen, but because she has been using oxygen.
Okay, good. Yeah. How is the rest of the findings, maybe on the abdomen?
The abdomen is soft and tender, not distended. And then,
yeah, the oxygen has improved much. That's good. Let me focus on the patient now.
You can see the patient.
Okay. Can I see only the wound part? If she needs focus on the wound. Okay.
Okay, you can pray with the.
Yeah, I can see it's not draining anything. The dressing is clean, dry. Yeah, no any discharge.
Yeah, no discharge.
No tenderness around.
No tenderness.
Oh, good. Okay. Yeah. Okay, thank you.
Yes. So she's just continuing with the antibiotics and also with the close monitoring. And still, as we said, she's going to be on a blood transfusion another. And we'll do a go for a full body picture. I mean, especially focusing on the globin level.
Okay, we may cover the wound. We've already seen. There is no edema on the legs or the feet.
No edema.
No edema, as you see.
Okay. Wonderful, wonderful. The team, Shirati KMT Hospital, very good to recognize the life-dangerous condition. The patient may continue on oxygen, supplement with blood if you see the HB is less than 8 in this patient who is symptomatic. If HB is less than 8, we may give the blood and the antibiotic. She may have an orthostatic pneumonia or an overload of fluid. Just minimize the fluid. Encourage enteral feedings if the bowel sounds are back. This patient may not need the referral to us. You are able to handle the patient, and I applaud the wonderful work you have done on this patient.